you come as now?
Yes, sir.
Where have you been?
Because I've been here.
Are you serious? Who are you?
You're welcome, sir.
Are you serious? Where you come as now?
Yeah, they won't go.
So most times we go.
It takes us less than 3, maximum 5 minutes to give somebody.
Each of them. This one? Like this?
You have? What's happening? This one is empty. That's happening. It's empty. You don't know? So, why don't we get it?
When Nani,
This one first.
that's a
Where's my other card?
One is yours, one is
No, one is not here.
this young lady called Puna. She's a security officer, data protection chief. A small boy is a chief. So tell Oga what you do.
Okay, so I'm the data protection officer and also the head of my unit. I'm in charge of managing issues with data protection compliance, ensuring that the commission is compliant and in line with the Nigerian data protection regulation standard, and also to advise the management on data protection rules and regulation, and to ensure that the commission is compliant. And also I help to manage annual data protection audit yearly for the commission. Also, I manage the commission technical unit, the commission technical unit, and also any other activity given to me or answered by me, sir.
Now, her duty, apart from protecting us, the rule is that when you take deposit from each other like yours, it must not be hacked and collected by anybody. So we are protected. There's an agency of government, federal government, that makes sure that every organization collecting data of humans must have a protective system that they can't hack you. And her duty is that of that unit. Again here, complaints from the field, like they were trying to register you and the computer is hanging or something. She's the one that is in the complaint and detail to one of these 4 persons here to quickly resolve the problems.
Okay, so your cards are protected.
Yes, sir.
They cannot be faked.
Information.
So you don't just take cards to any place. You go and make cards from businesses and go and use it. You cannot.
Because there is a QR code that is already attached to the card, so you can scan the QR code to ensure that that card is legit and it's not fake.
And you confirm in every place before dispensing. That's fine.
So we are as fast as that.
So it's nice.
When by the time you want to register the 100,
It's not a new one. I've been registered for a long time.
yes, this is just to retrieve.
Retrieve.
Yours is a new one. Yeah, yours is a new one.
Who is the new one? Okay.
With it,
Just sample, sir. Just sample.
What to present to me?
Yes.
Present my advice.
okay. I'm happy to present you your card. You can see how fast the registration was. Within 2 minutes of waiting, it was registered. Within 5 minutes, because it takes that for you. Please keep it well. This is more than ATM card. It's your health. Anywhere in this state you've got to and you are sick, branch any hospital and ask whether they are under the scheme and they must treat you. If there's anything, just call the office. reporting, disapparating out one after the other, one after the other. So we have that opportunity here for quick response to our customers. Once we print that, they send it here, and then we print it out.
So how long? What's the age on the train? The age is how long they take the train? 100.
You have the principal that already started.
Where was that person? The command. Okay, command. Okay.
In charge of the personnel files.
Yeah.
They're also in charge of leave.
That's all you do.
Yes, and work directly. HR.
Oh, missing documents.
Trace it from competence.
Ensure that even the place is bound can retrieve them. But yeah, before that, I think we're even acquiring more because it's volume of work is branded uniform for advertisement. Your friend is sitting down here.
Yes, so for a very, very long time. As 2005, I'm still at 7. Well, that's fine. So yeah, that has been. Oh, that's fine.
Doing a wonderful job. Commission from the one.
Yeah.
So they have the idea of commission. He's the director of ICT. And they've done it.
No, that's huge. Huge.
From the very
Yes.
It's a loss. 500 and something.
You know, we have
Obemeso.
Obemeso?
Yes.
Yes. I know you.
I know you, sir.
So where did you? The auditor is here today.
Well, so please ensure you take care of your health.
They are doing well. They are doing very well.
before they go, okay, autonomous staff employment program, they're going through the process. By Bluetooth, you can beam any data that is on it. Then when I go image, you can
Will it be the beginning of very God bless?
we have management. The board is made up of 10 members, headed by the chairman and other members. The board of this commission is unique, different from board of other commissions in the country, but was well thought out. The membership is not political, or say, oh, from Delta North, Delta South, Delta Central. No, it's stakeholders. We have the chairman that must have certain qualification. We have the G that must have certain qualifications. And then we have representative of Ministry of Health, because they are the service side, so I can know how the service side is performing. We have economic planning, so I can know about the economy of the place. We have labor, a special board, and have helped us a lot in work, which labor is represent the junior workforce of the system. So the majority of the civil servants through labor came in. And so labor protect their interest here. TUC deals with senior service, civil servants. They are protected here. CSO is one that shout to the world when things are not going to right. So this is the way. NECA talks about
all residents of Delta State have access to quality healthcare services. And to do that, we are implementing, regulating, and supervising a mandatory health insurance scheme. On the management end, we have 6 departments, and the departments are the Department of Planning, Research, Statistics, and ICT, the Department of Legal Services, the Department of Business Development and Marketing, the Department of Admin and Human Resources, Department of Health Services, Standards and Quality Control, and the Department of Finance and Investment. Our beneficiaries of the scheme, those are people that subscribe to the scheme. The law defines it as every resident of Delta State. It's mandatory for every resident. And we have 3 plans via which they can come in. We have the Equity Health Plan, which is a plan for vulnerable groups, currently defined as pregnant women and children under 5 for now. And in every public hospital, every pregnant woman and every child under 5 can access healthcare services in the public hospital. We also have a formal health plans for formal sector workers, that's the public servants.
Enrollees, output KPI, number of enrollees, and unit of measurement is numbered. Actual baseline at 2022 is 1,400. 2023 was 1,018 enrollees of the scheme. By 2024, we set a very ambitious goal for ourselves. We decided that we hit the ground running and we put 1 million enrollees in 1 year. And hope that by 2024, we have 2,800,000 enrollees within 1 year. And I'm happy you are here because you are going to help us.
I'm sure I and members of my committee who are pleased with what we have seen here. I presented this before severally in the House during caucus. It came twice, and also personally, and also during your budget defense. We as members of the House Committee on Health, you have responsibility and jurisdiction over the MDAs in which your organization fall into. As members of the House of Assembly, we have 3 basic functions: representing our people in the House, the act of making law, legislation, and oversight. Especially this one is guaranteed and provided for in the Constitution, Federal Constitution 1999 as altered. So what we come here to do is the fulfillment of the constitutional responsibility that we must do. We, unfortunately for us, there is nobody who is a doctor here. Nobody who has a head background here. So we felt challenged when we were made members of that committee and said we must know something about the health sector. Because if I call upon the area, you don't have anything to say. But move. It's either oversight. Hospitals, healthcare delivery is taken very, very down to the. So when I said I'm excited here, because what I've seen here, you are doing a great job here. And I learned something here. I don't know whether my members noticed it. I don't know whether the reason why you're succeeding is that you are gender friendly, because so most of our staff are women. Yes, because I observed it, and for what you are doing, I'm able to tell that. So in our organizations, we also make sure that women have a very good presence. I'm sure, okay, you're very happy with that. Yeah. So, Chairman and DG, I've taken judicial notice of some of the points that you have made. But from our own point of view, we feel that the challenge we're having here is a quick response to health delivery. I say that you are giving service, which is also likely to the hospitality industry. Hospitals and hotels are graded according to the speed in which you deliver service. If you go to the hospital and within 5 minutes, you are able to get treatment. If you go to the hotel, under 5 minutes, you are located at home. Your grade goes up. Those are the indices to create a caregiving organization. So our challenge here that members told you about your presentation why you said the caucus was how can our constituents get this service as quick as possible. They have been able to tell us a few things about how we intend to upgrade or to ensure that members and constituents have that. We are going to do that more because that's what is going to convince us. Because I'm talking politically now. If it is true that we enroll 700 people and 500 or 300 of them cannot get that service that we do, it's at a cost to us. Because as the person is going back from the hospital, you're going to make a call, I don't know, I couldn't get service here and I won't die. So from the 7,000, which is very, very good for us, we're going to spend like 50,000 by sending that money to that person so that he or she does not die. So the possible way to save that particular position, to cure that mischief, is to ensure that your delivery is as quick as possible. You see what I did here to show that I'm really interested? I ensured that my vice enrolled immediately. I also ensured that my lost ID card, I was able to retrieve it. I did that to show you that we, the committee, we have decided that we're going to stand by you. I told my committee members and some other members that this program is the cheapest I've seen. But there's no doctor you're going to consult even without treatment that you're going to pay 7,000. It's not possible. So if you are even getting that for that consultation before, because most of it is the drugs are not available, yes, we are aware. But they have been able to know the reason why you are sick. You are sick for some reason. This is your problem. So with that, we are convinced that the program should be on course. And in doing that, I encourage my members that when we leave here, we sit and look at the challenges which we discussed openly and the one we have discussed behind. So we're still going to discuss behind. Because this is a program that must not fail. If it is true that you are leading in the country in this program, others are following, you must ensure that you remain at the top. So that we can partner with us. We pride ourselves as the most vibrant House of Assembly in this country, for which nobody has questioned us. So if we're in the House Committee, I also lead it, means we are doing something together, as which are met at a particular point. And I also members that will stand by you at all times to ensure that your challenges are met. Well, you mentioned something here that struck me, corporate social responsibility, that is giving back. Unfortunately, we have not been able to enact that law in the House. We have it in the 7th Assembly, we have not been able to do it. Because if 28 companies out of 2,744, we have 2,744 companies in Delta State. So if even half of it engage CSR by enrolling people, you can imagine the mileage that you will cover. So we may probably go back and see how we can use some laws to encourage people to register. So we are convinced that this program will be sustained by law. We'll do everything possible that the challenges are met. They might not be met at a particular time, just one of them. The important is that they are on course. And one again, why I'm also excited, which I did mention in the traditional, what do you call it, traditional board,
Medicine.
Medicine that we went to, is that people should look outside government. Government cannot do it for us. Assuming government is only 10 billion, and every day you come here, sit here for government to bring that money, you won't have been able to achieve that mileage where you are today. Now they have gone out of the box to say, okay, well, you go, and they are even doing what I call fund drive by sending people. They are not even waiting for people to come and enroll here. Sending people to go and enroll here, and from here you are able to assess what they are doing. That's where to go. So I thank you and also encourage you to sustain what you are doing. While from our side of government we push that you get funds, but also remain afloat by visiting and going down to everywhere in Delta. Delta is the second model state in this country. So I think we all know the meaning of health, what health means to us, and with a little support that we'll give to you and the one you are doing, I'm very sure that this program will succeed and also I think that from this, my speech, I've been able to cover a lot that you have said. I have spoken the minds of my colleagues, not so. Once you succeed, you are making progress. And by God's grace,
first to reach 1 million, we are the first to cross 2 million. And the next state to us is Lagos State with 900. The third state is Kano with 800. Abia State by us here is just 41,000. Apart from that, we have worked a lot of laurel, like my chairman said earlier on. I don't want to go into all, but we have the first in even the ICT and everything. And then the governor, our present governor, wants us to maintain that tempo. I remember when we went to a program in Abuja, and they were talking, they didn't mention Delta. He was a speaker then. And he got up and said, what is happening here? Delta is number one, and we are discussing health insurance in Delta State, our present governor. And they apologized and brought Delta into the true picture. So we have achieved quite a lot. I don't want to read you. It's in the document I submitted to you, and we want to maintain that standard. My chairman here is very, very determined to ensure that we will hit the ground running and also achieve more during his tenure. And I'm happy that you are very friendly. You're not a doctor, but I'm even more friendly than a doctor, the way it is. So we thank you very much.
yes, like I mentioned while we're in the boardroom, I and my committee members are excited in this particular oversight. We're very happy with what we saw here. The program is on course, and this program needs to be sustained. And we're about that we do all that needs possible to ensure that this program is on auto cruise. It can run without hitches. It is by way of legislation or by way of interface. Any intervention that we need to do to ensure that this program goes on, we'll do it.
Is there any area of concern from this visit? Something you think you want to work on absolutely?
Yes, I mentioned immediate service delivery as much as 5 minutes. And the DG and the chairman have promised that they are going to earmark certain areas for us where our constituents can go and get service delivery as quick as possible.
Yeah, recruiting health personnel is still a very big challenge to the state. And you're talking about quick services. How do we solve this problem? How is government going to solve this problem?
Yes, this is why I said I'm very happy with what I saw here, because this scheme, this organization have already gone beyond that, and they are also on their way, if not recruiting staff by themselves to fill the gap between those people who are not here, those people who have gone away from the service. So they have already gone beyond what we are thinking to go to do it without government intervention. And I think I encourage them, because that's the way to go. Government cannot do it all for you. If by your IGRO you can recruit staff that will stand in between the gap for you, it's the way to go. So I encourage you to sustain it. I will support you in that direction.
So Chairman, the House of Assembly has 59 members. So can you tell us that how many of your members have keyed into this program?
So I cannot give you an exact number, but I know people, without coming together, you will not exactly know what they are doing. Like the chairman did not even know that I was already an enrollee. When I came here, they keyed my names into it, they were able to print a card for me. So the program is good. A lot of members have keyed into it. But with this expose that we have today, a lot of members will come into the document.
Okay, so apart from your...
From what you have met on ground, what is your word to members of the public from what you have observed?
Yes, I use the opportunity to call on members of the public to key into this program, especially to meet the target of 1 million by this particular year, 2024. So I see the opportunity to call on my constituents and also the constituents of other of my colleagues to key into the program. The program should be sustained because it's the cheapest that I have seen. So it should be sustained. Nowhere you can get health delivery for 1 year for 7,000. So people should key into it and get the benefits of the program. Thank you.
Is there any plan for you to support your constituents to enroll them?